I think it would be helpful to have two things for the patients. One is a questionnaire, so they can go read through the questions and see with the symptoms that we would normally encounter with the menopause, and check by themselves how many of these symptoms they do have. And this, I think, would raise awareness, because often women are aware of things like the hot flushes, but the mood disorders are often um, underestimated and dismissed. The brain fog is not considered, or the aches and pains that come with the menopause as well may not be associated with the menopause, but rather with the normal aging process. So I think a questionnaire, so the patient can test themselves and become more aware of their symptoms that may be related to the menopause, and then a leaflet that explain what the different options from lifestyle to supplements and prescribed medication are for menopause. I think that in the past couple of years a lot has been done, especially since the documentary by Davina that was seen by many women and has prompted them asking for help and support menopause, and has reduced the shame that comes with the menopause. I think having open conversation, having afternoon teas with doctors, online webinars, having resources that go to the patients, go to the women, and talk to them, especially if these resources allowed the women to express their concern, to ask questions, and to have those questions answered by specialists. And I definitely think that these resources need to be widely available, and need to be some more information need to be given also to men, to increase their understanding and help them implementing changes in the workplace that would help women going through the menopause. Unfortunately, the standard GP training does still not include a detailed and in-depth study of the menopause, and it's all often relegated to as a minor thing in GP day-to-day practice. I found particularly helpful targeted webinar to specific guidelines for the menopause, like the recent guidelines on the HRT and the changes in HRT prescriptions, the changes in the risk involved with HRTs, because I find that often there is still the perception that there is a high risk with HRT, and so they are not readily made available to the women because of these concerns. So definitely providing this information in a short and targeted format would be really helpful, as all GPs are very busy, and I think that even though a half day on menopause will give a lot of information and will help a GP becoming an expert in the treatment of menopause, the majority of GPs won't have the time or won't have the will to attend a webinar only for that specific subject. So I believe that shorter and more targeted webinar or Yeah, I believe webinar would be the best option, as when we provide written information that are not always read. When we have like 5-10 minutes webinar, it's more likely that people will have the time to click on it and listen to it while they're potentially doing other things, so it will reach a wider public.